Hello everyone, myself Dr. Alpa Chavda. Today I am going to discuss about the yesterday question that had posted in our academic group, that what to do in such kind of the patient, because we see in today's era we see lots of the patient with decreased fertility, and that's why there are so many IVF centers, fertility centers are blooming all over across the country as well as across the globe. So very important, it's on the borderline question that patient, 33-year-old patient, active married life 8 years, AMH 0.3 with semen parameters normal and patent tubes. She had been undergone multiple cycles for the treatment, but the answer is unable to conceive. So what to do when this patient comes to you? So there are different doctors, different opinions, different things are there. But we should keep in mind, suppose first answer has been ovulation induction and the timed intercourse. Is it right? For some consultant it may be right, but from my side I would not prefer, because age is the clicking bomb in this case, because age advances as well as AMH is drastically low 0.3. With 0.3, quality of the oocytes are very considered to be very low, quality will be very low, so I would not prefer to waste time anymore. So from my side, option A is out of question. Option B is IUI. IUI definitely has some extent in improving the pregnancy rate. It helps to inseminate the semen near to the oocyte during the time of the ovulation. But here the problem is decreased ovarian reserve. We don't know about the quality and the quantity of the egg, how it may be there. So I would also not waste the time to do IUI. The third option is IVF with the self oocyte. If it's a first cycle, first attempt, then this is the perfect answer. But here also we have to counsel very to the couple that with age and the AMH, because we don't expect AMH is the only criteria. We considered age, AMH and the AFC. But like since my 20 years of the practice in the fertility, I had observed those who having the low AFC, means central follicular count, with low AMH, the quality and the quantity of the eggs we are getting are very less and the bad oocytes. So here we have to properly counsel the patient that we can do IVF with your self egg, but quality and quantity is the answer for your success rate. In some cases, we may explain egg pulling in such kind of the patient if they are keen for the self oocyte. So what we do, we can do 3 to 4 IVF stimulation. Every times we do oocyte retrieval, we do embryo freezing, and we can wait till 3 to 4 good quality of the day 3 embryo available, and then we can go for the either day 3 or the blast transfer. So egg pulling considered the best option if we get at least good quality of the embryo in the first IVF attempt. So overall, the answer most preferably will go with the C, IVF with the self oocyte. The fourth option is IVF with the ovum donation. That is also to be explained to the patient that sometimes patient is like that, they wants the result, they don't want to go just in the trials. So we have to explain that IVF with the self oocyte, we have to give the trial, or sometimes we can counsel in such a way that we do the first cycle IVF stimulation. If you get the good quality of the oocyte, it's a fine. If not, then you may have to go for the IVF ovum donation. So that is optional thing we can advise to the patient. So I hope you will all understand about how to choose choose right option at a right time, and what to advise the patient for the future plan. All answers could be correct, but right time, right decision is very important in the fertility practice. Bye bye, everyone.